All right. Welcome everyone to Big Feelings, Little Bodies. It's an introduction for pediatric chiropractors into HeartSpeak and what you need to pay attention to and what you can do about it. So I'm Dr. Anne Jensen. I'm a chiropractor, been a chiropractor for 30 years, trained in New York, migrated to Australia, practiced there in a big family practice, and then was accepted to study at Oxford. So I sold everything up there, and went to Oxford for the better part of 10 years. I have a, master's in evidence-based social interventions from Oxford, and I have a DPhil, a PhD in evidence-based healthcare from Oxford. And along the way, I got a master's in psychology. So I consider myself a mind-body practitioner. So, and I've been developing HeartSpeak. Well, I've been teaching HeartSpeak for 11 years. This is the 11th year. And and the reason I developed HeartSpeak is because I needed it. My emotions were all over the show in my 30s, hormones, even especially during different times of the month, I just was a mess, I was miserable. And and as a chiropractor, I realized, as a subluxation-based chiropractor, I realized that, using D.D. Palmer's philosophy that subluxations are caused by trauma, thoughts, and toxins, physical stress, chemical stress, mental, emotional stress. Now we have things to address physical stress. We do nutrition, chemical stress, and then I didn't really have any tools to address mental, emotional stress. So I started looking around, and I did some tapping, but wasn't really happy with that because I didn't feel a change, and I really needed things to change. And I did some affirmations and they just pissed me off. And then I read a research study later that affirmations don't work in about 10% of the populations because I, you're, I don't buy into it. It sounds like a lie to me, and I hate lying. So I tried other things too. I did NET for a while, and that kind of scratched an itch, but HeartSpeak is like NET on steroids. Give me a wave if you've done NET or have any sort of emotional release technique that you do. One, two. Okay. All right. So I thought today, this is like an introduction, like I can only cover so much in an hour, but what I thought I'd do is spend the first half or so, depending on how things go, talking about what some important facts you need to know about feelings and feelings in general, and then feelings in children in particular. And then the next half or so will be you experiencing it. And because HeartSpeak is an experience, you actually feel different after when you do some clearing. So that's what I want to experience. And then at the end, questions and answers. Does that sound good? All right. First thing I wanted to make you aware of is that feelings come first. The body will sense, the body senses before the brain makes sense of things. Does that make sense? So the body senses before the brain can make sense. And young children experience feelings in the body long before they can tell you, articulate what it is what's going on. So um, you will hopefully notice body changes first when the little ones are struggling. So that's one thing. Another thing, little bodies, even though kids' bodies are little, it's not proportional. A little bit of stress can be quite overwhelming for a little body. Even small amounts of stress, like changes in routine, even changes in your tone of voice, unmet needs. It's a huge, huge stress on a little one. And stress is cumulative. They can add up impact a child's nervous system. Um, Also, when you're working with children, behavior is a form of communication for them. So when a child has a meltdown or when there's defiance or withdrawal, these are all nonverbal messages that a child is overwhelmed. So, and they're not naughty, it's just they don't know what else to do. They don't have the language to tell you what's wrong. And even if they did have the language, they don't know what's wrong. So they behave in a way to try and fix it. Other facts. Talking, believe it or not, research shows that when you talk about your problems, it can block the feelings. And I know talk therapy, talk about your problems. You'll feel better. Yeah, you do feel better because it suppresses your feelings. It's when you talk, your feeling mind is suppressed. So me personally, if I don't necessarily want to feel better when I'm upset. I want to use that experience to not get triggered again. I want to fix the problem rather than just get rid of the symptoms. I mean, that's what we're all about anyway. And I think, an emotional upset, that's a symptom that there's some sort of something's out of balance. The the system's in overload, overwhelm, and they start expressing symptoms, whether they're physical, behavioral, mental, emotional, or relational symptoms. Yeah, so it's really difficult for kids to talk about their feelings using words. And even, they have those, this is how I'm feeling, this sad face, boo-hoo. It's it's hard for them. It's hard for kids to do that. Um, yeah, so another interesting fact is that is about labeling feelings. If you push a kid to tell me how you're feeling, label it, what's going on. Um, it's not always helpful, but I don't want to just tell you it's not always helpful. I want to show you it's not always helpful. So I'm going to ask you to close your eyes. And the reason I ask you to close your eyes is to go inwards. It helps with interoception, which is an inner sensing. So close your eyes and remember a time recently that you had a big feeling, a big emotion, whether it's good, bad, or in between. It doesn't matter what it is. By the way, I don't think feelings are good or bad. They just are. Okay, and then bring to mind that memory of a feeling and put a label, put a word, put a feeling on it, whatever it is. Joy, sadness, angry, whatever. And then I want you to feel the inadequacy of the label. What's kind of spilling over that the label doesn't cover. It's almost like you're trying to put, a liter, a liter of milk in a teacup. It doesn't fit. Can you feel the inadequacy? Can you feel the edges are spilling over? Okay, good. Yeah, so labeling feelings isn't always helpful. You can open your eyes now. So when you say you're angry or you're sad, um, when you tell a child, oh, are you angry? Um, and this is changing. I've seen this change over the last, say, 10 years. Um, Normally, we are born feeling, right? We are born feeling. We don't have to learn that. There are feelings that we do learn, but we don't have to learn how to feel. We just feel. And then what happens is our adults in our lives, usually adults, is they put a label onto a feeling. So maybe a child is, having a tantrum and having, rolling around the floor, and then the mom will say or dad will say, "Oh, are you angry? Get off the floor, stop." And then the next thing they say is, "Stop being angry. There's nothing to be, you shouldn't be angry." So they learn, okay, well, what I'm feeling is anger, and then it's not okay to feel angry immediately. And, little boys, they'll start crying, "Oh, you sad?" Boys don't cry. So first of all, they are having big feelings, and then mom or dad puts a label on the feeling, and then they're immediately told not to feel that way. So there is a problem with labeling feelings like that. Um, mm, and it's also the adult interpretation of the feeling, that what we see the child experiencing. Say we see a child experiencing a tantrum, and all you see is the anger that's coming out. What you don't see is the sadness and the fear that might have pushed that that child into the anger. And so he's got all these feelings that's coming up in him, and then boom, he's said he's angry, but really he's just really sad, and it's coming out as anger. Um, uh, and also because of all this, children learn to suppress feelings early. They're told, "Oh, you're fine. You don't cry. Be brave." They're all really common phrases we say to our children. So children then learn that. And this can happen even before the child even has language. So this happens really early on, and these patterns of suppression are set up. So it's not really, this happened to you too as children. So it's really not your fault. It's just the way society is it is. I was going to say at then, but it's still going on. So it keeps happening. Another thing you need to know is that stress, you probably do know this, is stress shows up physically, in the tummy ache or you've or the skin rash or the eczema flares up or bedwetting or clumsiness or daydreaming. So that's not a physical symptom, but you get the idea. So physical symptoms are often the body's way of expressing an unprocessed emotion, basically. Um, so talking about feelings actually doesn't heal it. Processing comes from feeling the feeling, not retelling it. And there's problems with retelling and retelling and retelling. When every time you tell the story again or tell someone how you feel, and this is true not only for adults too, every time you whinge to your friend or call your sister or you tell it over and over again, think about what that does to neurology. Neurons that get neurons that fire together get wired together. So that pathway is going to become ingrained in your nervous system and automatic. So we don't really want to retell stories and keep going down that rabbit hole of feeling. Um, and Mary Ellen, can I tell the story of a story? Remember when one of your kids didn't,
What
yeah,
story?
didn't get into
So
the
many.
high school?
Yeah.
It's when one of your kids didn't get into school and she was inconsolable. Remember that one?
Yeah.
Yeah. So, you know how important secondary school is. You're a 12-year-old or whatever it is, and all her friends were going to one school. And she applied, she was going to go to that school, and she didn't get in. All her other friends got in, right, Mary Ellen?
Well,
Right?
it's because she was out of catchment. That was the problem, which of course means nothing to an 11-year-old.
No. Exactly. Exactly. So she was inconsolable for hours, hours and hours, right? She was up there in her room sobbing. And then Mary Ellen called me and or messaged me and said, "What do I do?" And I said, "Well, how do you feel?" She goes, Mary Ellen said to me, "I'm devastated as well. I'm heartbroken too." I said, "Get up there and tell her that. Cry with her." Right? You did that and it was over,
Mm.
wasn't it? Pretty much. That's how I remember it. Is that how it worked, Mary Ellen?
Pretty much. I think yeah, it was hard. It was
It was
hard
hard.
because, all
Yeah,
the
it is
normal
hard.
things that are logical to us as an adult as to why she didn't get in. Two of her friends were out of catchment as well, but they already had siblings there before they changed the catchment area and all that. So, all the adult things that are logical and are still stupid. But yeah, she just wasn't having any.
Mm, yeah, exactly. There's no logic. You can't reason with an upset child. You can't reason with an upset dog either. So, all right. More co-regulation before expectations. No, we'll mention that. All right. So, I'll just tell you a few case studies about some of the kids I've seen over the years. Um, Tommy had tummy aches. He was 6 years old and he had recurrent stomach pains. And he had all the tests, no medical cause for them. Everything, all the tests came up clear. And they actually started right before his dad left the marital home. Um, and the tummy aches always came on the Monday before school started. So we did some HeartSpeak on the tummy ache and no more tummy aches. So that was good. Good result. Another one, a little Lena. She was 4. She was 4 and she was a screamer. She was always yelling, and being defiant and just out of control. Um, and it started when baby brother came into the picture 2 years before. So she'd been screaming for 2 years. And she was 2. So she was 2, baby brother was born, started screaming, yelling, and and being defiant. So we didn't pick up that it was baby brother, but in hindsight it was. But we worked on the wanting to scream, wanting to yell all the time, wanting to define the no. Yeah. And that settled it down and she's pretty happy now. All right. What else? Oh, Ruby's rash. Yeah, Ruby had this rash. She was 5, this eczema. She had eczema, and it always flared up under times of stress around changes. Um, I think she was it started when she was 5, so I think she was when she was 6. One of her favorite teacher was having a baby, so she left mid-year, and it really flared up then. That's when she started to come see me for some heart speak. And the rashes only flare up now under extreme stress again. They still flare up, but it's much more manageable. Um, okay. And then, of course, bedwetting, and we all like to adjust for bedwetting, and that works great. But what if it doesn't, So we had Josh. I had Josh. He was 7. He started wetting the bed again after the parents started fighting a lot at home, and there was no real other signs of upset or distress. His body was just really holding all that stress in. So I don't think maybe 3 or 4 HeartSpeak sessions, and I see kids for about 20 to 30 minutes, depending on how old they are. and the Bedouin settled down. And his mom just brings him in if he has an accident or something like that. Not brings him in, has a session because I usually do it online. So those are some things. I also want to mention Liam. Um, Liam is a autistic 12-year-old, nonverbal autistic, and but bright as a button. He's so bright. And he hits himself basically when he gets upset, and he's started not walking. He said he hurt his foot. Well, he didn't say, but he wouldn't walk because he thinks his foot hurts. But we adjusted it, and he still wouldn't walk. But with a nonverbal child like that, I asked the mom to do the clearing on the child's behalf. So we did a session, a little half-hour session on Liam's general stress levels, and um, mom rang me up the next day. This just happened this past week, and completely different child. Easy to get along with. He's usually easy to get along with, but he had been having quite a lot of frustrations and hitting himself, but that was all calmed down the next day. So that was a really good result. All right. So who you would you like to experience some HeartSpeak? All right.
Yes.
So HeartSpeak is an experience. Kitty outside. Hello, Kitty, beautiful. Um, so so what I'm gonna do first, you're all chiropractors, so I like to do this in groups of chiropractors. So I'm gonna ask you to sit up, turn your heads to the left and right as far as you can, and you probably can't turn as far one way as you can the other. And turn to the way, to me it's my right. And when you're turning that way, there's going to be some place that it feels blocked. Like to me, it feels there. Okay. Yeah. All right. Touch that spot where it feels blocked. Yeah. All right. Let's see what's in that. That's an emotion, an urge, a resistance, a pleasure. Okay. This isn't going to make sense. Pleasures don't often make sense. You can take your hands away. What we're going to do we're going to invoke a feeling of pleasure, and we're going to we call that the clearing, and you're going to feel pleasure. I'll walk you through it, don't worry. You're going to feel pleasure until it sort of doesn't make it any matter. It doesn't matter anymore. um and pleasure is this. Oh gosh, that feels good. I really like that. And you don't even have to know what the source of the pleasure is or why it feels good. You just got to just dive into it. So we take a posture. I'm gonna get you to come forward in a ball. Yep. And then tuck your head in a ball, and in your mind's eye, dive into a beautiful pool of pleasure. It's that, oh gosh, that feels good. I just really like that. Oh, it feels so good. And you know what? You can have as much as you want of this pleasure. Put everything aside besides this pleasure. Doesn't matter. Swim around in it. Lose yourself in this deliciousness. And then, if should it diminish, dive deeper in this pool of pleasure and get more of it. And when it feels like you've had enough, sit up with your eyes closed. And then take a breath in and open up the front of your body, head back, eyes closed, head back, shoulders back, chest out, and look in your heart space for a feeling of pleasure on the inside, an intrinsic pleasure. Now, this is bliss. Let's call it bliss. Enjoy bliss for a moment. Bliss out for a moment before opening your eyes. And then when you're ready, turn your head right and left again. See how that feels. And give me a thumbs up if you feel better. It's better. Something's given. Something's released. Does it feel different? Yeah. Good. Excellent. Um, and so that's an example of a physical symptom. So we work with physical symptoms, of course. Um, and we work and yes, oh thanks Emma, thanks Millie, or I don't know who the Harpreet and Melissa, thanks for the message. Okay, so yes, we work with physical symptoms. We work with physical symptoms, you know what they are, emotional symptoms. They are anything from feeling down, anxious, stressed, uh, upset, hurt, etc. Um, yeah, good. Okay, those are emotional symptoms. We have behavioral symptoms, which are any sort of, on the one extreme, addictions and compulsions to any sort of unhealthy behavior or anything you want to change that you're having trouble changing that you're doing, that even something like that. Or I hate, oh, I don't want to, do something. Or this is a good one that I used to do with my CAs is they hated doing recalls, calling people that missed, really useful. And also we do relational symptoms, any type of, intimate relationship, partnership, kids, or we can work stress around kids or parents and mother-in-laws and, any business, anything. So, um, I would like to work one-on-one with someone who has something that they've worked on so that you can see how it works, how it goes. We're also going to do it, we're going to do a child, but after this. So if anyone has a symptom, whether it's physical symptom, emotional, relational, behavioral, that they want to address, that they've tried doing they tried to fix it and is still around. Does anyone have anything or a physical symptom too? It doesn't matter what it is. And you're willing to, you don't have to divulge. Oh, that's right. You don't have to divulge all your inner secrets. You don't even have to tell us what you're working on. Come on, someone's got to have something. Mhm. Anyone? Oh, Claire, go ahead. Oh, you're unmuted. Yeah, what do you got? Oh, well,
I guess,
can you tell us or no? It's okay if you.
yeah, yeah. Well, so one of my difficulties is feeling emotions. So even just that exercise is quite hard
Oh,
because I feel like I can't feel anything. So is that something that you could work on? Or how would you work on?
absolutely.
Yeah.
Yes, absolutely. Let's do it. Anyone else relate to that? By the way, the research, yes, Mary Ellen, yeah. The research shows from Paul Ekman, he's an emotional researcher, he shows that practicing feeling and you get better at it. So there is hope for everyone. All right. So which feeling would you like to feel that you can't feel, you think you can't feel, Claire?
Oh, great question. Love.
Okay, great. So this is going to be your experience. So, and that's all that really matters here is what you're experiencing on the inside.
Mhm.
So I'm going to ask you just to look for the feeling of love. Just look for it. And there is something to clear. I'm getting a stress response. And when you look for it, I'm going to keep looking for it and feel what it feels like inside when you look for it. There might be a flutter or a clench or tightness in the chest or the throat. And remember that. All right. And you can relax again, Clara. Let's find out which feeling we're going to use: an emotion, an urge, the urge to fight, the urge to flee. So the urge to flee is one of the stress responses, the fight or flight responses. And these come up whenever there's a threat or a danger. It's not safe, right? So when there's an urge to flee, it's I gotta go. I gotta get out of here. I don't like this. I don't like this. Love, forget it. I'm going out of here. Where can I go? Where can I go? I'm not safe. Okay? There's urgency, there's panic, there's desperation. Okay? So I'm going to get you to come into a ball like a scared rabbit and look for that urge to flee. Flee, flee, flee. I gotta go. I want to go. I really want to go. I want to go. I want to go. And if anyone resonates with this, you can do this too. You can tag along. The urge to flee. I want to go. I want to go. I want to get out of here. I don't like it. I don't like it. It's uncomfortable. I gotta go. I gotta go. I gotta go. Keep looking for it. If it diminishes, try to bring it back. Until you don't have to flee anymore. Until you can just be. When you can just be, check again. But when you can just be, sit up with your eyes closed. Eyes closed, head back, shoulders back, chest out. Look in your heart space for a feeling of calm. Sometimes it's hard to find calm after a flee, but when you find it, it's like, oh, there's calm, and then drop into it. Choose it. Sit in it. Despite what's happening externally, you can still choose calm on the inside. Then, from the point of view of calm, turn toward the threat, the danger. And now there's just calm. Imagine it coming towards you like a river, a current in your face, but now there's just calm. And feel it go over you, around you, through you. But you still choose calm. Enjoy calm and amongst the turbulence for a moment. And when you're ready, open your eyes. All right, Claire. Now I'm going to ask you again to look for the feeling of love. And tell me what you noticed. Tell us what you noticed.
I can't find the feeling of love, but there's more of an openness in my belly.
Good. Is there any warmth? I was getting a lot of warmth. Would you call
Yeah,
it
it's kind of like,
warmth?
yeah, like tingly around my belly and my chest.
Okay, good. So that's a step forward. So that's good.
Yeah.
Thank you. Thanks for sharing that. Good. Um, let's go with I want to let's do another clearing of a painful memory. This is I would call this an emotional symptom. Everyone has painful memories. A painful memory I would consider a, a memory that when you bring it up, it still hurts you. It still feels
Hmm.
bad. Yeah. So let's do that with everyone. So if you want to, you don't have, of course, have to play along. So I'm going to ask you, everyone, to think of a memory. And if you've ever had trauma, please don't choose the worst memory you've ever had. I'm going to ask you to choose something that still hurts. Like, I wasn't invited to her 8th birthday and it still hurts. That kind of thing. Not trauma. And then sit with that memory, mull it over, mull it over, mull it over, and try to work yourself up for this, just this moment. Feel the pain, lean into the pain. An emotion, an urge, yours to fight, the urge to flee, run away. Okay, everyone into a ball, like a scared rabbit, like this is similar feeling to the last one we did. The urge to flee, I want to go. I don't like this. I don't like this. It's uncomfortable. I just want to get out of there. It's not safe anymore. I just want to go. Just want to go. Just got to get out of here. Should it become more settled? Bring it up again, exaggerate it. Really make it big and bold, physical and real. Keep going. There's more in there. Urge to flee. I gotta go. I don't like this. I don't like it. I just want to go. I'm uncomfortable. And then take a big breath in and then open up the front of your body, head back, shoulders back, chest out. And look for calm on the inside. Calm. It's in there. When you find it, drop into it. Choose it. And let the calm soak into every cell of your body, every corner of your mind. And then turn your attention to that memory again. And once again, try to become upset by it. Try to work yourself up. And give me a thumbs up if it feels feels more neutral. Yeah, feels, eh. Okay, good. Okay, now this next one I want to do is for people that have children. Um, thanks, Dorian. Um, and um, I want to do the same thing, same sort of thing. And if you don't have children, you can do it for yourself. Because I want, for those of you who had children, I'm going to ask you to pick one child of yours and then a situation that that child often gets upset about, an upset that happens to that child. And we won't know the outcome, but it'll be interesting. Um, so you're going to pick a situation that's upsetting, that will likely happen again because it's happened before many times. It's going to happen again, and it still upsets your child. Okay, and then I'm going to first ask, in your mind's eye, ask for permission to work on your child. Okay. And the intention I have when we're doing surrogate clearing like this is that whatever feeling that comes up will benefit the, the patient, not you. And I do have to say here, when you're working on your child, it could be a little bit confronting because you're actually, it feels really real to you. And it could be like, wow, I didn't know she felt like that, or I didn't know he felt like that. So just, it'll be interesting. So does everyone have a situation? Yeah, you got something? Okay, good. So, and then your mind's eye, I'm going to ask you to be your child. Step into his or her shoes. Look at his or her eyes. Put yourself in that situation sometime in the future, because it's going to happen again. And I want you to feel how intense it feels. 0, there's no pain, there's no hurt. 10 is the worst ever. Yeah. And just for those of you with their cameras on, just give me a number with your fingers, how big it feels to you. 10, 7. Yeah. All right. That's good. Okay, you're going to keep that, still be your child, and keep the situation in mind. An emotion, so fear, anger, sadness. Okay, we're going to use sadness to clear some of this away. And you're going to be your child, hands over your eyes, tuck your head, lengthen your breath, and sigh out the sadness. It's a big breath in and sigh it out. On your child's behalf. Sigh it out. It's like you're walking through a tunnel. You're walking your child through that tunnel of sadness. Lean into it. Feel the pain, feel the heartache. Starting to settle, but come on, lean into it a bit more. Let's clear as much as we can. Use your breath. Big breath out, one more sigh out, and on the breath in, sit up with your eyes closed, head back, shoulders back, chest out. Look in your heart space for a feeling of peace. Peace. When you find it, drop into it and let that peace grow and glow within your child's heart. Fill every cell of his or her body with this peace. Surround it. Wrap her up in a big blanket of peace. And then mentally time travel to the future again as your child when this situation comes up next, because it will. And I want you to really feel this situation. Feel how your child reacts. And then really try and get upset and work yourself up as your child. And then on a 0 to 10 scale, rate the intensity of the upset. 0, there's no upset. 10 is the worst ever. Okay, 5, good. That was a 10 to a 5. That was good. 4, that's good. 7 to 4 is good. All right. And for those of you who are on, have no pictures, just give me a thumbs up if it feels different, feels better. Okay, good. Thank you. Okay. So how does this work? I don't really know how the surrogate clearing works, but I'm going to tell you why HeartSpeak works. And HeartSpeak could be considered a reconsolidation-based therapy. Reconsolidation meaning memory reconsolidation. So if just real quick, how memory works, an event in our lives, and if an event in our lives becomes important enough that we'll need to remember it, it goes from working memory, gets put into long-term memory. And then once it's stored, we go about our lives again, and then that memory is triggered by a thought or a smell or a taste or a vision or a sound, and that gets put from long-term memory, gets put into reactivated, it gets put into working memory, and you use it. It's like, oh yeah, I was here before and this happened. I just have to be careful about that. And then we're done with it, and then we put it back into long-term memory. That's called reconsolidation. Now, during memory reconsolidation, the memory becomes soft, it becomes flexible, it can change slightly, and it does change slightly. We don't have to do anything particular, even though in HeartSpeak we are doing things particularly, but it will change it slightly. There'll be slight detailed shifts, and then we store it again. And then we go about our lives, and it gets triggered again by something else, some other stimulus, and it goes from long-term memory, gets put back into working memory. But the one that gets put into working memory is the one we stored the last. So this can go on, and we can change it every time we recall and store, recall and store. Every time we store it again, we can change it. It's like playing Chinese whispers or telephone as a kid. The story the first kid hears can be completely different than the last kid. So because we know that's how memory works, we know that memories are inaccurate. And there's two kinds of long-term memory. There's explicit memory, which are the facts, called declarative or recallable. The facts. I was 7, I fell off my bicycle, broke my arm, had to go to hospital. Those are facts. That's mediated by the part of the brain called the hippocampus. The hippocampus is fully formed around the age of 3 to 5. So that's why it's really hard to remember facts much before the age of 3. The implicit memory also with time deteriorates. It kind of gets mouthy over time, gets patchy. We don't really remember details as well. Also with stress, if you've ever crammed for a test, crammed facts in and then got stressed about the test, and the facts go right out the window. That's also what happens with when there's stress, explicit memory just goes. The other type of memory is implicit memory. It's non-declarative, non-recallable, and it's mediated by the amygdala. Now, there's a couple of types of implicit memory. I'm talking about the feeling types, the emotional type of implicit memory. The amygdala is fully, we have cells that become the amygdala. We have amygdaloid cells from day one in the womb. So, when their conception, 2 cells become 1, and then 1 become 2, and then 4, and then 8. By the end of 24 hours, there's a blob of cells. In the blob of cells is our amygdaloid cells. So we could be making implicit memories, feeling memories from day 1 in the womb. So also implicit memory with stress, it escalates. The feelings get worse and worse and worse. And more intense, I should say, not worse, just more intense. And with time, implicit memories escalate with time as well. So this is what we're going to, this is why we use implicit memories with HeartSpeak. We know the facts. We know that explicit memories are changeable. So we don't remember about the fact. We don't have to worry about the facts. So we just put them aside. We don't have to know why you're sad or what the sadness is about. Doesn't matter. We just have to get sad, bring the sadness up. And exaggerate it as big as possible and make it as physical as much as possible. So then when we are done, so when that's what we do, we feel sad, feel sad, feel sad, feel sad, and then, oh, that feels better. We have to let the sadness run its course. And then before it reconsolidates, gets put back into long-term memory, we pivot and put peace in there. So the next time that memory is triggered, we're less likely to be sad, more likely to feel peace. If we do that enough, it's like eating an elephant one bite at a time. You do it enough, the whole situation will like resolve, feel less, we're less and less and less likely to be triggered again. And it works on physical symptoms because the cool thing about memory is that we don't know where long-term memory is, storage is. We don't know where they come from. We don't know we know how it works, but we don't know where storage is. And there's a theory that I like that it's in the fascia. The fascia holds long-term memories, and emotional memories in particular. And if you've ever done yoga and had emotional release, or had a massage and got upset for no reason, an implicit memory was released. And so that's why it works with neck rotation. That's why it works with muscle tension. It works with organ dysfunction, bladders, and all that. It's because the fascia releases and then the symptoms go away. That's the theory. Cool. Now, I've talked a lot. Do you all have questions? I'm sure you do. Does anyone have a question about this process? I think it's a process that it's really easy to implement into practice. I can do a real quick HeartSpeak clearing on a patient in a minute. And those pros as well, where you don't have to go down that rabbit hole of what happened when you were 7. It doesn't matter what happened, just feel sad, you know? Uh, and and with kids especially, it's like the little game, and they really quite get into it. They really are much better at it than us adults. And they respond so beautifully, don't they, Mary Helen?
Yeah. Do you remember that one that was the biter? He was about 2,
Yes,
I
that was
think.
classic.
Yeah, he was a
Yeah,
biter, kept biting all the kids in his nursery school. And it was to the point where they weren't
yeah,
come back.
yeah.
Yeah,
So
well, that was one. Yeah,
what I did with that kid is that he was only little. I think he was not even 2, right?
yeah,
Yeah. So he's not gonna he doesn't know why he's biting. He just wants to bite. So of course I got mom to do the clearing on the child's behalf, but the child was sitting there on the floor and playing. And the I forget what feeling it came up, but mom was clearing that feeling, and the kid was like, how did you know that's how? It was like the expression on his face was like, that's exactly how I feel. And then he stopped biting.
yeah.
It was cool.
It never happened again.
Yeah. It's the wanting to bite that we cleared. The drive to bite. And that's a feeling, that's a behavior. So
Mm,
that was fun.
it was cute.
So was that useful? Was that interesting? Mary Ellen has been bugging me to do this for how long? A year? Yeah.
Hi, Anne. Thank you so much for this. This is great.
Yeah.
I had my video off because I just scarfed my mouth with chicken. I
Oh
was just
yeah.
like, I just got like, my kids were like, Mommy, the chicken's getting cold. Anyway,
Yeah.
my question is, because we all see a lot of kids, and the surrogate is great because just doing that
Yeah.
example is, I was blown away because I've been just dealing with this, as Marilyn knows because she's been adjusting me whenever we see each other at our seminars, this Atlas block, and that just freed up and opened up beautifully. So, and I know it's emotional, it's embedded with emotion. I mean, I don't even know what it is, but
Doesn't matter.
yeah, exactly. And and so network and Donnie Epstein and somatorespiratory integration. So I do a
Yeah,
lot of
sure.
so I do a lot of that, which I think, like Mary Ellen was saying, that it's in some sense SRI is similar, where it's tapping into the the healing that, you know, the stored trauma and stuff like that, but like I've never, it doesn't address like a surrogacy. And because we see a lot of children, I see a lot of children, and there's a lot of kids that have the things that you were talking about, like bedwetting and biting and hitting. And so is
Yeah.
it, can it just be done in that way, just so simply, like that example that you just did with us?
Yeah, absolutely.
It is
Absolutely.
Okay.
that simple.
And
Yeah.
and very quick. It's not something you have
Yeah.
to spend a lot of time doing. In fact, just get in, get out, and that's it. Yeah.
Yeah,
And it's
that's
really,
amazing.
really, yeah, it's really kids just take to it like water. And also, you know, when the kid has had enough, almost all the time they just want to fall, they just want to lie down. It's hilarious. They'll just go, they're done. Dogs too, by the way, but that's another story.
Oh, cool. That's cool. Oh, you can
Yeah,
do this with animals too. That's awesome.
yeah, it's fun.
Wow, that's incredible, because it's so, it just seems that it directs, it just, yeah, it's quite direct, but in a way where it's, yeah, there's no fluff. And and I love how you, because this is the first time I've ever done it. I mean, I know that Marilyn and I were so close, and she talks about it all the time, and she talks about you all the time, and yet I've never experienced it. And I love how you were just saying how the labeling, and you don't really, you know, you're gonna, you know, when you experience, or when someone says, are you angry or are you sad, and there's just, it never really captures that person's emotion and an experience. So that's brilliant, just the way that you described it. So wow, it was really great. And it just gives so much more insight and opening to what we could do, and how we can yeah, utilize this for us as practitioners and for ourselves. That it was just, yeah, really, really, really awesome. So thank you.
Yeah. I can give another example of one we had with a kid who was 4, and he had a really severe asthma attack, and he was in the hospital. And when he got back from the hospital, he wasn't able to sleep. And of course, you know, we're the adults going, oh, well, you know, it's really scary being in the hospital and all these strange people around, and you know, all the needles and the machines and all this kind of stuff. And so we kind of went through the HeartSpeak thing with him, and what it turned out to be is that the biggest fear he had was that when he went to the hospital, there was these big sliding doors, and they kept opening and closing by themselves, and it really freaked him out. So every time he closed his eyes, he all he could see was these sliding doors. You know, so he just, you know, we cleared the fear, and it took a while to kind of figure out, you know, to pinpoint a few things that it was the fear of something specific that had nothing to do with the medical side of things, but it was the overwhelming lack of control, and those doors were opening and shutting by themselves. Just that was it. And we cleared that, and he went to sleep, and he didn't have any problems sleeping after that.
Yeah, it's pretty amazing.
Can I ask
Yeah,
a
I'm pretty,
question, please?
yeah, please.
So, Mary Ellen, you were just saying you had to dig a little bit deeper there to get to the exact fear. So, are you um, just verbally asking the 4-year-old questions?
No, we
Can
cleared
I
it
just
as
say
a
something
fear.
here? Can I just say something? That's actually not what I teach. I
No, no,
teach that,
it was after. Sorry, I'll make this clear that but
uh,
when we did the heart speak, it was fear that was the issue.
Okay, okay.
Afterwards, we were talking to him.
Okay, okay.
That's when he said, you know, oh, it was actually, I was scared of the doors.
Okay,
You
fine.
know, so but that wasn't heart speak, but that was the conversation after the heart speak.
Oh, yeah,
Yeah.
thank you. So the heart speak is basically feel a feeling, make it really big, curl up in a ball, make it as big as you can, and then open up outwards and feel peace or calm.
something
That's it in
lovely.
a nutshell.
pretty much. That's where
Right.
the therapy is, it's pretty
Yeah.
simple.
Okay.
I describe it as well as bringing it from, you get stuck in your head over things, and you're
Yeah.
taking it out of that thinking brain into your feeling body,
Yeah.
and then releasing it, and then Anne pivots it to a more positive thing to bring it into the body.
Okay, great.
Yeah.
And Anne, can you talk about there's obviously neurological significance between going into flexion versus then out into extension?
Yes, there is. You want to experience that? That's a really good question. Let me show you. And it's important for chiropractors to know this because it's a posture thing and it relates to not only their physical health, but their mental, emotional, and social health as well.
Yeah.
All right. So come into a ball, a really tight ball, and feel fear. Fear, 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 fear. Just notice how easy or hard it is to feel fear in there. And then remember that and open up into what we call our open posture or our pivoting posture. Open up, head back, shoulders back, chest out. Really open up the chest and shoulders and look for, in this posture, look for love. Claire, try and look for love. And just notice how easy or hard it is. And then stay in this posture and look for fear. And then come into a ball like you were before, tight ball. And then in this closed posture, protective posture, let's look for love. And what did you notice?
Yeah, it's much harder to hear
Yeah,
and hear.
even you did it.
Even
Congratulations.
me. Oh my God. Must be good.
Oh, that's fantastic.
But what's happening like neurologically I mean, I know that's true, but
Oh, I don't know neurologically what happens, but
oh,
I know
okay.
that it does. I know that does happen. Um, yeah, I'm an experiencer. I'm a
Yeah,
more,
yeah.
I don't, yeah.
Can I
Okay.
suggest something? Can I say, when you think of the polyvagal stuff, that, in terms of safety, when
Yeah,
dogs feel really safe, they sleep on their backs with their bellies
yeah,
exposed,
yeah,
which is a trust posture, isn't it?
yeah.
Whereas when you're scared, you do
It's
curl up in a ball and you try to
yeah,
hide from things. So maybe that's the neurology, if that,
sure.
in terms of the polyvagal aspect
Yeah,
anyway.
yeah, yeah. Thank you.
Yeah. What about all you
Lurkers.
people, hiding people? Any questions from in the chat?
Oh, yeah.
I'll just ask, so I did the thing for my daughter and I talked to Mary Ellen about this. Um, but she has a habit of saying really strong things, which I know she doesn't mean, but her go-to with me, when she's angry or sad or whatever the feeling is, the feeling that I can't label because it's so big, I'm gonna cut your head off with a wire. Or I'm just going to cut your head off. And it feels so, I mean, it feels it's like, shit, man, where did that come from? You're like 5 years old, 6 years old. And that's always been
Whoa.
the like method of when she's, upset with something I've done or not particularly I've done, just whatever. That's her go-to.
That's,
And
Mm.
it's
yeah, that
intense.
sounds old.
But yeah,
That
well
sounds like she brought that
and
in
I
with
was
her.
and I was just like, it does feel like pain, like so much, yeah, so much pain. And that's what I got when we just did the HeartSpeak then. It was like
Mhm.
so much sadness and pain that I actually started to cry.
Yeah,
And
yeah.
and then it was quite a nice relief. So it went from a 10 to a 5, which was nice.
Mhm.
And
Yeah.
actually she's been in quite a good space these last few days. So
Mhm.
it was easier to get the good feeling, but it's so intense. So when you said think of a thing, there's no specific thing that I know that triggers it. It just gets
Yeah, yeah,
triggered
yeah.
and it tends to be around transitions. But I was just like, wow, it's so big.
Yeah, yeah, yeah.
Where do you go
Yeah.
with that kind of thing if you feel like it's really old and it's maybe
Yeah, yeah, I would either, have a session
messing with you?
together
Yeah.
with her.
Okay.
Yeah, or Mary Ellen or Who else? There's Priscilla up in Bedford and Matlock. Priscilla So, she's fantastic.
Oh, Priscilla So, yeah, I know who she is. Yeah.
Yeah.
Yeah, up there. There's also another practitioner up near there too.
And can we do it online?
Yeah, so I just this past weekend I just taught a level 1, but that's okay. There'll be another one in September online.
Which I would do
I,
for her.
Yeah.
Yeah. Okay. Oh, thanks.
Yeah, thanks, Mary Ellen. Yeah, and Harpreet's asked as well, where can I train? Yeah, and you know, I would be really open, Mary Ellen and Marianne, to if you guys want a HeartSpeak level 1 for particularly tailored to pediatric chiropractors, that would be fun.
yeah,
Mhm.
that would be good. That would be really good.
Yeah, it would be super fun. I mean, it would be you'd learn all the level 1 stuff, but we'd kind of add bits and pieces, you know, that would be super fun.
Yeah, that would be really good.
Wouldn't
That'd
it?
be definitely worth doing because I know,
So
like,
we can talk about that too.
yeah, with more
And we can
people.
do it online. It's not it's something that I always teach online. And
Yeah, that would be amazing.
unfortunately,
I love, I mean, I like online stuff when it's an hour to, 2 hours, but I think like the COVID is just like, I just maxed out
Saturation.
for
yeah,
like
I know.
weekend Zooms. And I love being with people. So, and we love to get together. And I think
Yeah.
that would be it would be really great to plan something if you're open to doing that. And hopefully you'll be here more permanently.
That would be cool. Yes, we like it when Anne's on this part of the continent.
Yeah,
Yes, we do.
Keep your
Yes, we
fingers
do.
crossed.
Yeah, fingers
I
crossed.
Mm.
I just interviewed at the Scottish school here in Edinburgh, so keep your fingers crossed.
Fingers are
It'll be
crossed.
fun.
I'm, I can't even imagine that it's not going to happen.
Yeah. I mean, I'm the only chiropractor on the planet with a PhD from Oxford, so they really have
Yeah.
to.
Yeah, no shit.
You have so much to offer, though, in terms of the clinical side as well. You know, the research, obviously, from the PhD and evidence-based medicine side, but I think the skills and having female tutors in chiropractic colleges is something that's always been missing and sorely needed. So,
It's true.
Mm,
I'm
yeah.
just going to turn the recording off because I'm going to send this out to everyone.